Hi TMJ Disorder sufferers, Simon the Shiatsu Guy here again. This is my video series on how to get relief from your TMJ symptoms. This video is on some of the common symptoms of TMJ, particularly linked to or specifically around the jaw. These are kind of the obvious ones. I'm going to do a second video on the slightly less obvious ones. So first of all, common symptoms include sort of a pain or tenderness in the face, particularly around the TMJ joint, that can be caused by opening the mouth, chewing, speaking, all of these use of the jaw. Can also be involved in the TMJ and getting stuck or locked either in the open or closed position, quite disturbing and very unpleasant. Then also the sort of clicking, popping and grating within the TMJ joint when you chew or when you speak. This may or may not be painful. Also tired feeling in the face, particularly the sort of muscles of the jaw, and trouble chewing or sudden uncomfortable feeling in the jaw when you bite. And then also, if the upper and lower teeth feel like they don't fit together properly, this is also part of the TMJ where the jaw isn't really aligning, and potential swelling in either side of the face or in this joint here around the muscles. So there are common symptoms of things directly related to the TMJ. The next video I do will be about things that are a little bit less obvious but can also still be related. So see you in a moment. Hi TMJ Disorder sufferers, Simon the Shiatsu Guy here. This is my video series on how to get relief from your TMJ symptoms. This video is about the symptoms of TMJ, but the less obvious ones. So the previous video I talked about conditions that are obviously linked to sort of disorder or displacement of the TMJ, and these ones are linked or can be linked, but are maybe less obvious, less likely. So you've got things such as toothache. Obviously can be due to dental issues, but can also be due to TMJ. So clenching or grinding the teeth can result in toothache, as well as headaches. So a lot of headaches are not related to TMJ disorder, maybe dehydration for example, but they can also be linked to the TMJ, particularly sort of temporal headaches where these muscles here on the side of the head are overworking, and can also be here at the base of the skull if the kind of head and neck alignment is not kind of working right due to this, and we'll cover that in a later video. Neck aches, obviously sort of similar link to this. Dizziness, so obviously your ear is right next to your TMJ. If there's pressure onto the ear is instrumental in balance. There's something called I think it's called a labyrinthitis. Comes from this, where sort of this fluid doesn't move properly. This can be affected by the TMJ. Hearing problems, similar. You've got the ear is a very highly complex little organism going on there. So if there's impact from the jaw into that, it can cause hearing problems. Pain in the upper shoulder, this muscle here, that can be similar to the neck, and all this tension. So we'll cover that in the next video. And then tinnitus, which seems like a strange one, but it kind of goes along with the labyrinthitis and the hearing issues. If the TMJ is causing problems into the ear, then that is, that's a definite symptom. Potential symptom could also be just from too much clubbing or loud music, or working in noisy places, or some people are just particularly sensitive to sound. So those are some less obvious symptoms to relate to the TMJ. We'll be covering a lot more in future videos, so I hope you keep tuning in, and I hope you find them helpful. Cheers, see you soon.